Chronic diseases are responsible for 74% of the global mortality, and these present a paradox in the modern medical health care. While medical science has achieved remarkable feat or progress in acute care and infectious disease control, it struggles to deliver cure for conditions like cancer, neurodegenerative diseases, and autoimmune diseases. The World Health Organization estimates that 1.7 billion people live with chronic diseases, and many of these face problems for decades in progressive disability, psychological distress, and financial ruin. Conventional medicine, anchored in pharmacotherapy and surgical interventions, often prioritize the symptom suppression over the curative or holistic strategy. And this approach leaves the patient trapped in cycle of the treatment dependency, side effects, and diminished quality of care. The limitation of modern medicine are multifaceted. Pathophysiological complexity, underfunded research into rare diseases, and disparity into the healthcare access increase the crisis and suffering. For example, therapies for Alzheimer's disease target amyloid plaques but fail to halt the neurodegeneration, while insulin manages diabetes without restoring the metabolic homeostasis. Furthermore, the marginalized population, particularly low income regions, face delayed diagnosis and unaffordable treatments, and that widen the gap in the health equality or create health inequalities. In therefore, the alternative and complementary medicine has emerged as both a refuge and a contested frontier in the landscape. Modalities such as acupuncture, yoga, and herbal medicine are increasingly sought by the patients, disillusioned by the limitations of the conventional care. And I myself, when I had this sciatica and a nerve trap in the radicals of the vertebra, with severe excruciating pain all over the body, needing hospital admission, and me being wheelchair bound for a long period of time, I have used, in addition to the conventional modern treatment, which included various variety of painkillers, including the non-steroidal medications, morphine orally, and pregabalin, I used complementary alternative medicine, including the acupuncture, cupping therapy, osteopathy, yoga, tai chi, and qigong, and the herbal supplements in order to improve my own symptoms. And I am now able to walk normally, while I would have remained wheelchair bound. God only knows if only one or the other method was used. I suggest therefore a holistic, complete use of everything like tool in the toolboxes, as and when needed in a combined way, is much better for the patient care, addressing not only the physical symptoms but also the emotional and social dimensions of the suffering. I therefore recommend that integration of the complementary and alternative medicine into the mainstream healthcare should be recommended rather than living a fragmented situation. I would therefore try and address this unmet need in the chronic disease management through a evidence-based approach, synthesizing the clinical data, the socio-economical analysis, and patients' narratives, including myself, to argue that synergistic approach combining the precision of modern medicine with the holistic principles of complementing or alternative medicine could redefine the chronic disease care in 21st century. So I would say that burden of chronic diseases underscore the critical juncture in the global healthcare and the limitation of reductionist cure-oriented models are increasingly apparent, and yet a promise for holistic patient care remains underexplored. Modern medicine's triumphs in extending the life expectancy have not been matched by the equivalent gains in quality of life for chronic disease patients, and many of them endure lifelong disability and marginalization. While breakthroughs in genomics, immunotherapy, and artificial intelligence hold future potential, immediate solutions are needed to improve the suffering of billions with chronic diseases. Alternative and complementary medicine thus offer a complementary toolkit to address these gaps. And modalities like mindfulness based stress reduction, acupuncture, and omega 3 supplementation simply demonstrate measurable benefits in the pain relief, inflammation reduction, and psychological resilience, often with fewer side effects than the conventional therapies. Yoga's dual impact on physical mobility and mental health is in multiple sclerosis patient exemplifies the complementary and alternative medicine's capacity to address the multidimensional suffering. Similarly, probiotics and dietary interventions highlight the importance of microbiome health in managing the metabolic and autoimmune conditions, a frontier neglected by the traditional pharmacotherapy. We must remember that complementary and alternative medicine is not a panacea, and its integration into mainstream medical care require rigorous evidence generation, standardization of practices, and safeguards against misinformation. Herbal interactions, variable supplement quality, and unvalidated energy therapies pose risks and that demand a regulatory oversight and clinicians' education. Equally critical is addressing the systemic inequalities, and the benefits of complementary and alternative medicine must not remain accessible only to affluent populations. Policy reforms to subsidize the evidence based therapies and expand the rural healthcare infrastructure essential for equitable care is paramount. And there is a need for paradigm shift from siloed disease-centric model to integrative frameworks that prioritize patient autonomy, prevention, and holistic well-being. Clinicians, researchers, and policymakers must collaborate to dismantle disciplinary boundaries, fostering innovation that respect both biomedical rigor and traditional healing wisdom. By embracing this synergy, global health community can transform chronic disease management from a narrative of despair into one of hope and dignity.